The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. I'm your host, Don McIntosh, and today we're joined with Dr. Philip Mills from Wichita, Kansas. Welcome, Dr. Mills.
Hi, Don.
You know, you told me that you have a specialty, and you used a very fancy word. You said you're a physiatrist. What exactly is a physiatrist?
Well, actually, I said physiatrist, but it's physical medicine and rehabilitation. There are several specialties general specialties in medicine. There's surgery. That's the diagnosis and treatment of those diseases that are best treated with surgery. There's internal medicine. That's the diagnosis and treatment of those diseases that are best treated with medications. There's the psychiatric types of specialties, which deals with problems in the mind. And in physical medicine, we deal with those diseases and diagnoses of problems that are best treated with the physical modalities: physical therapy, occupational therapy, speech. And we deal with pain problems, musculoskeletal problems, and the sequela, the long-term problems, and some of the acute problems of neurologic disorders.
So a neurologic disorder would be like a stroke or those types of things?
A stroke would be one, head injury, spinal cord injury.
Well, today we're going to talk about strokes, and I know it's kind of tongue-in-cheek, but it's going to help us. We've kind of entitled today's program, as we were talking, different strokes for different folks, and there's really nothing funny about that. But really, what is a stroke, and how many strokes are there in the United States each year?
Well, worldwide, actually, there's varying numbers of strokes. In Nigeria, there's less than 100 strokes per 100,000 people. Now, they may have some problems with counting accurately, so it may be slightly higher. In Australia, there are 329.1 strokes per 100,000 population. We're somewhere in the middle. We have about 150, actually varies depending on the study, but approximately 150 per 100,000 people. That means every year there are approximately 1 million strokes here in this country, and of those, 600,000, more or less, again, I'm giving you very round numbers, about 600,000 are people who have never had a stroke before.
Well, that's interesting. Now, you know, some of our viewers today, people that have joined us, maybe think, well, this is nothing for me. I'm a young person. Is it something the young people should worry about, or is it just for people that, you know, what age do strokes occur?
Unfortunately, strokes can occur in any age. You can have strokes inside the mother's womb while the fetus is developing, and when they're born, we call that's one form of cerebral palsy. You can have strokes as a child, and up till age 8, we call that adult cerebral palsy for certain types of reasons. Then you can have strokes as teenagers, particularly among drug users. There's also strokes that we see in the 20 to 30 population among females that are taking birth control pills and smoking. We see strokes among young people that have a genetic problem of the blood vessels in the brain. And then, of course, as a person gets older, they have more and more risk of stroke. And by the time a person is over 80, there's about a 13% chance per year that a person will have a stroke.
So it increases when you're older, but at any age, anyone watching today should learn something that's very helpful.
Also, at every age, you're exposed to stroke. And I remember I didn't understand anything about strokes when I was 3 or 4, but because my dad was a minister, we'd go visiting in the hospitals, and I would see people with strokes, and it was something I didn't understand.
Mm-hmm.
And I think it's very helpful for us to understand the common problems that people have.
Well, let's just go back then to try and understand this a little bit. What exactly is a stroke?
Well, historically, the word stroke has actually been used for different diagnoses. At the time of Christ, if a doctor said you have a stroke, or a common, they would say, oh, that person had a stroke, they weren't talking about what we would call a stroke today. They were actually calling leprosy stroke. And by that they meant it was a judgment from God. The finger of God is another name for stroke. In the Middle Ages, however, people developed these symptom complex that we now call a cerebral vascular accident or stroke. And what happened, in the middle of the night, they would have this sudden onset, or maybe even during the day, of paralysis on one side of the body, or they might not be able to speak.
Just go numb.
And it was so sudden and so striking, they thought this must be a judgment of the hand of God on them. And they would call it the stroke of God, the stroke. And so today, we still have the residual of that term, and we call it a stroke.
Would it be safe to say that anything that happens suddenly is what they thought was a stroke?
Well, if it had certain symptoms, a sudden onset of lack of movement on one side of the body, sudden onset of difficulty in talking. And generally, that would also be associated with a weakness on one side of the body.
Okay. And then memory loss, is that something that happens with stroke?
Yes, in fact, that may be the only symptom of a mild stroke. They may have a sudden decrease in memory, or maybe have a sudden episode of confusion, and that may be the only symptom of a stroke. There are other strokes that they may have no symptoms at all.
But if someone has a question about whether or not they've had a stroke, would it be fair to say that if it hasn't come on suddenly, it's probably not a stroke?
If a person is getting gradual weakness on one side of their body, gradual loss, then you have to think of some other causes, including tumor, whereas strokes are generally sudden.
We have a nice model here. Looks like this person may be left-brained.
I think he's just open-minded.
Anyway, tell us a little bit more about what happens in a stroke, maybe using the model here.
Well, what a stroke is actually loss of blood supply to some area of the brain. And since every area of the brain has certain blood vessels that go to it, obviously you can have many different types of strokes. In fact, in my practice, and I've seen thousands of strokes, I have never seen a stroke that was exactly the same as another stroke. Now, there are 3 major blood vessels that service the brain here. To the front, there is a blood vessel that goes to this area. That's called the anterior.
So that's the frontal lobe, or?
Yes, and that area. And then in the back, this has to do with some vision, the posterior cerebral artery. And then in the middle, surprisingly enough, it's the middle cerebral or brain artery.
Well, that was inventive.
Now, there are, of course, many other blood vessels, but those are some of the major ones. And depending on which blood vessel is involved, that depends on the symptoms that a person has.
Let me ask you a question that's sort of about the subject, and we want to come back, of course, to strokes, but you know, you hear a lot of talk today about someone being left-brained or right-brained, being creative or analytical, being this or that. Is there anything to that?
Actually, early on when they were studying strokes, a person that would have a left side involvement or a right side involvement, they did notice some differences. But in actual fact, the pop psychology idea of left-brained or right-brained, for the last 25 years, those who have really studied it have shown that that is really nonsense. There are some differences, but it's not like you hear in the popular psychological culture. And so, in fact, that just shows that most people don't really know the differences in the areas of the brain.
Now, if someone does have a stroke, say on the right side or left side, different things do happen to them, though,
Yes.
right?
Now, the way that God designed the brain. One of my professors says he did it because he wanted to confuse the neurosurgeons. Actually, the left side of your brain controls the right side of your body. And for most people, it also controls the speech centers. And so if you have a stroke affecting the left side, you may have some problems on the right side. If you have a stroke on the right side, you may have some problems on the left. There's also, generally associated with a right-sided stroke, you may have some problems with judgment. You also will have problems with spatial orientation. It's difficult to get your clothes on, for example. And one of the most interesting problems in a person who has a right-sided stroke and a left-sided weakness, if it's profound, they may have difficulty in reading a person's face. And so what you say to them is all they can interpret from what you are.
So you can't wink at them. You can't make gestures or those kind of things. They just won't pick up on it.
If you say the opposite of what you mean, sometimes we'll say the opposite of what we mean, but we're saying it in such a way that the other person knows that we don't mean it.
I'm just doing great. I'm doing great.
Right.
Okay.
They won't be able to understand that. And so there's those changes. They become what we call very concrete in their understanding of conversation.
A few minutes here, we're going to take a break, but before we do that, I want you to cover with us, this title, Different Strokes for Different Folks. Are there actually different types of strokes?
Well, there are three major causes of strokes. The first cause is right in the brain itself. The blood vessel begins to get sludge on it. We call it atherosclerosis. And as it begins to worsen, then a person can actually develop a clot right in the brain itself.
Okay.
Now, that type of stroke often will show itself first with very short strokes that we call transient ischemic attacks, or TIAs, that last for just short times. There's another type of stroke, and that type of stroke is where the clot forms in some other part of the body. Mm-hmm. In about 45% of these strokes, this is embolic, the other would be thrombotic, this is embolic. It would come from a person who has an arrhythmia in the heart, and the blood is not circulating quite right in the heart. They have atrial fibrillation. And so it clots there as it's just sort of milling around.
So it breaks up some of the little blood cells, and then they form a clot, and then they go to the brain.
Then they go into the brain, and they get caught in one of the blood vessels.
Okay.
And so that's another type of stroke. Then the third kind of stroke is where one of the blood vessels bursts, and you have a bleed. And that, of course, is very dangerous. And the treatment of these three different types of strokes is different, and so it's very important to have a complete evaluation. Now, there's another way that the stroke can form, and that is the blood vessel goes into a spasm. Mm-hmm. Now, it can't spasm forever, but as it relaxes, there may have been a clot that formed. And so certain types of disorders can cause the blood vessel to tighten up and cause a spasm.
Let me see if I had this straight, and then we want to come back and talk a little bit more how we can avoid this, hopefully, a stroke. We have a vascular spasm that can go into a stroke. We have a rupture of the actual blood vessel. We have a blood clot, and then the other one was, what was the other one that we talked about?
You have two kinds of blood clots. You can have a blood clot right there in the brain itself, or you can have a blood clot elsewhere that sort of makes its way up to the brain.
That's amazing, this many different types of strokes. When we come back, hopefully you're going to share with us how to avoid having a stroke. We hope that you'll join us.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Diehl and Dr. Eileen Ludington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who were able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Deal and Dr. Ludington have been featured on 3ABM, and in this booklet, they present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
Welcome back. We've been talking with Dr. Philip Mills about strokes, and we've discovered that there are 3 different types of strokes. But as we were talking, we want to know how to avoid strokes, Dr. Mills. We're not so interested in the different types, although I know that's very important. Has there been anyone in your life or your experience, I know you've seen thousands of strokes, but anyone in your experience that has had a stroke that's really touched you personally?
First, let me say this, Don. Not only am I concerned about strokes and people who have them, but a lot of the people around the listeners and around me have pre-stroke behavior. Mm-hmm. And by pre-stroke behavior, I mean they are engaging in activity that produces strokes in a certain percentage of people. There was a lady that worked in my hospital, and she was just really vibrant, vivacious, fun to be with, and she was only 50 years old. But I discovered certain lifestyles that had caused her blood pressure to be quite high. In fact, she was having blood pressure of 240/150 when I took it one day. And I was, of course, very concerned about that and urged her to immediately get that blood pressure under control, see her primary care physician regarding it, and take appropriate steps to get it down now. With high blood pressure, what can happen is the blood vessels burst, and then you have a bleed, and that's one of the most life-threatening types of strokes that you can have. Well, nothing changed. I even made arrangements for her to see a primary care physician, and she was too busy to go.
So she wasn't listening to you.
She wouldn't make changes. Then I begged her. I said, you know, you see the patients as they come in. Mm-hmm. You're only 50 years old. I don't know when it's going to happen to you, but one day you're going to be not a receptionist here at this hospital. You're going to be a patient here, and you're going to be paralyzed on one side, and that's if you're lucky. Mm-hmm. And a month went by, 2 months went by, 3 months went by, and 2 years ago, this was just fairly recently, 2 years ago, I had my nurse run into the examining room where I was. I was actually seeing a patient. She said, you have to come out right now. And my nurse was crying. And she said, this receptionist was just ready to leave work, and she had developed a very severe headache, and she was beginning to lose consciousness. Would I go see her? So I ran back to physical therapy where this worker was laying down on a mat. And there she was mumbling almost incoherently, but I could tell she was saying, my head, it's the worst headache I've ever had. And she was becoming less and less conscious. Well, I was very concerned that she had had a bleed. Blood vessel had burst. So we called the ambulance and had her taken immediately to the large acute care hospital that our rehab center is associated with. And by the time she arrived at the hospital, she was completely unconscious, and they did special studies, CT scans, and they did find a great deal of blood in her brain. In fact, the neurosurgeon went in and took out a grapefruit-size clot. And he called me up. He said, she's not going to live. Well, very fortunately for her, the surgery was successful, and over a prolonged period of time, she began to improve, and she did come back to our rehab hospital, paralyzed on one side. And at 50 years old, because she had a very severe problem, at 50 years old, she was severely handicapped, will not be able to work ever again. And I determined, after I saw this, that I would do everything I could to encourage people to avoid those factors that lead up to strokes, the pre-stroke behavior, as I was referring to it.
So one of the big things I hear in that story, and every good physician will tell a story because I think doctor means teacher, doesn't it? And what I hear in that is, hey, you know, listen when somebody's talking with you, especially someone that knows what they're talking about. But the other thing I heard is that high blood pressure is not something to toy around with. Is there anything else that we can really focus in on that we need to avoid if we want to avoid having the big one or a stroke?
Well, another real big one, high blood pressure. And a high blood pressure, let me say, it's dangerous because it doesn't cause any discomfort as a general rule.
So it's a silent...
So it's a silent killer. But that is very important. Another biggie in the area of stroke is smoking. Now, I already referred to smoking and birth control pills, but smoking in and of itself is a big contributor to
Why is that?
To stroke. We believe that the problem is it's a vascular constrictor, and there are other poisons and effects of the cigarette smoking. But if a person stops, within a very few months, the risk of stroke begins to decrease. So a person immediately, when they stop smoking, is decreasing their risk of stroke.
So if you have high blood pressure, get it checked. If you're smoking, stop smoking. What about having a little alcohol? I hear that thins the blood. Is that good for strokes?
Alcohol is a major contributor of strokes, and also it causes not only problems with strokes, but it also has problems with balance. So a person may have a stroke and fall, and if they have a little bit of alcohol on board, they might not have good judgment to get help. And so it is a complicator and a causer of stroke. So a person should not drink one alcoholic beverage.
What about things you eat? Are there things you can eat that hurt you or that help you?
Yes. The very same foods that hurt your heart cause strokes. It's exactly the same. And so the person who is being kind to his heart is being kind to his blood vessels, he's being kind to his brain and decreasing his risk of stroke. What that means is the fruits, grains, nuts, vegetables, those are the good foods. The foods that are high in fat, the meats, the high-fat gravies, the high-fat dressings, those are all stroke contributors. And so we should avoid those and go to the low-fat and avoid the high-fat diet.
So the fettuccine Alfredo and all those things that make our mouths water are pre-stroke behavior.
Pre-stroke behavior.
You know, I worked for several years in a hospital myself as a nurse, and I noticed that the diabetics many times seem to have problems with stroke. Was I just noticing that, or is that a fact?
No. Diabetes is another contributor to stroke for several reasons. One of them, it also affects blood vessels, but it is associated with stroke as well as with other vascular problems.
One thing you said at the beginning of the program, some of the people just joining us may not remember this, but it fascinated me when you said that you can have a stroke even before you're born. Explain that. How could we avoid that? Maybe there are some pregnant mothers or those thinking of starting a family.
Well, sometimes they're caused by forces that we don't understand, but some drugs that people take increase the risk of a stroke in utero, and certainly the illegal drugs increase the risk of stroke. And if a mother who is pregnant can have a good, healthy diet and can have abundant exercise, that decreases the risk of stroke for not only her later, but it decreases the risk of stroke in the baby.
So exercise, that helps us avoid stroke. How does that work?
Well, it works several ways. One way is it improves the vascular strength of the blood vessels, and it also can help decrease your blood pressure. But in general, we find that the people who are slothful, lack exercise, have an increase in strokes.
So when you talk about the vessels being improved by exercising, does that mean when the vessel, you know, when your heart bumps or beats, bumps, when it beats, you know, more strongly and firmly, that interplay of the vessels, that makes them healthier? Is that what you're saying?
It does, yes.
Okay, big meals, are they dangerous?
Yeah, particularly what has been very amazing, the last 2 or 3 years, there's some studies that have come out that shown that one fatty meal increases your risk of both heart attack and stroke, just one high-fat meal. And if a person has a high-fat meal and immediately sleeps after that, that can also increase his risk because of pooling of the blood and because it's pooling with real high fat in it.
So get up right after you eat.
Yes, help your wife with the dishes.
Do the dishes, walk the dog, do something, but
Yes.
don't lay down on the couch.
Yes.
You know, I've got to say that that's been a temptation of mine in the past. So I mean, that's a tip for me. I'm sure many others as well. You know, a lot of people that have joined us today probably know people, or maybe they've experienced a stroke themselves. We've got about a minute left here in the program. And I know you're a Christian physician. What do you say to the patient who's done everything right, but something like a stroke happens?
I'd say the same thing that Paul says, and I'm just memorizing this text, so I brought the list of my memory work here, and I pulled it out of my pocket. This is Romans 8:22 and 23. For we know that the whole creation groaneth and travaileth in pain together until now. And that's certainly true with all the problems that are there. But he then adds something very interesting. And not only they, but ourselves also, which have the first fruits of the Spirit, even we ourselves groan within ourselves, waiting for the adoption to wit, the redemption of our body. In other words, Paul is saying that even though he was filled with the Spirit, he had problems in his body. And he couldn't wait for the second coming. And I would say to the person who has a stroke that the good news is there is deliverance at the soon coming of Christ. And look for it just like Paul did.
Thank you so much for being with us, Dr. Mills. You've given suggestions for those who want to avoid a stroke, and you've given hope to those that maybe have had a stroke. I hope that you can come back on another program and share more with us for those people that maybe have had a stroke. Thank you for joining us, and we hope you have health for a lifetime.